Welcome to episode number 20 of Reimbursement Readiness, Business Tips for Wound Practice, presented by Kathleen and friends. I am honored that you have taken time out of your busy schedule to join us today. Many listeners have been asking me to provide a report about the launch of the WISER Prior Authorization Program in New Jersey, Ohio, Oklahoma, and Texas. Surprisingly, many of the requests have come from listeners who practice in other states and are not participating in the WISER program. The reason is they're wanting to improve their own documentation of reasonable and medically necessary. And so they're very interested to know the major reasons why the authorizations are being either approved or denied. Therefore, several weeks ago, Jeremy Bowden and I invited stakeholders who are participating in the WISER Prior Authorization Program for the application of cellular and/or tissue-based products for skin wounds to share their first month's experience with our listeners. I was honored by the quick responses that we received and by the information that was shared. A few professionals said they were no longer applying CTPs because they did not want to go through the prior authorization process. But most professionals said they were still applying CTPs and had built the prior authorization process into their workflow. To my surprise, many of the professionals reported that the participation in the WISER program was beneficial because they knew in advance if the CTP application was covered before they purchased the product. Other professionals said they appreciated the 72-hour turnaround time, which allowed enough time to order and receive the right size product before the patient's next scheduled visit. Most of all, the respondents appreciated that they received clear reasons when prior authorizations were denied. So far, no one has responded to me or said that they received prior authorization approval to apply a CTP to wounds or ulcers other than DFUs and VLUs. Now, I was looking to interview people from each of the states. And of course, I can't do all of that in one. So when I spoke to one of the early respondents who volunteered to share her first month WISER experience, I knew the reimbursement readiness listeners would enjoy hearing her describe her learnings. Therefore, I invited Kati Kauchel to join us for today's episode entitled WISER Prior Authorization, First Month Real Life Experience, an interview with a nurse practitioner. Because you are in for a real treat today, please join me in welcoming Kati Kauchel to Reimbursement Readiness. Kati, thank you for agreeing to share your real life experience with the listeners and me. But before we begin our interview, will you please tell our listeners about your business, the states where you have been submitting WISER prior authorization requests, and which method of submission the professionals have selected?
Hi, Kathleen. Thank you so much for having me on today. I'm super excited. My name is Kati Kauchel. I'm a doctorate prepared nurse practitioner. I have over 8 years of experience in wound care. Started my career in the hospital setting, working trauma, surgical, and burn-related wounds, and then later transitioned into an outpatient wound care and hyperbaric medicine clinic. Eventually moved into a clinical operations leadership role overseeing multiple wound care clinics in Texas. And then last year, I stepped into the consulting world and founded Kindling Consulting, where I help mobile wound care organizations stabilize and grow clinically sound, compliant practices. I'm currently working with teams in Texas and Oklahoma that are submitting patients through WISER, and they've been submitting straight to the program participants. So thank you again, Kathleen, for having me, and I'm super excited to get started.
Well, thank you so much, Katie. Now I'm going to ask you the questions that the reimbursement readiness listeners are anxious to have answered. So the first question is, as the WISER Prior Authorization Program rolled out, what has surprised you the most about how professionals and their revenue cycle staff are responding to participating?
Yeah, that's a great question. I feel like all of us, especially as this is rolling out in different states, probably have a little bit of a different feel for what's going on or different experience. But for myself, one of the most surprising things has been that there's been a decrease in submissions for the groups that I'm working with. It almost feels like many providers are a little bit nervous to submit under WISER, maybe kind of a real level of anxiety in a sense that their clinical thinking, documentation, and care plans are suddenly more visible than they ever have been. Historically, denials have felt more like an administrative issue because they happen after the care was delivered. But WISER moves that spotlight more upstream into clinical planning and documentation, and that's really a meaningful shift. When a request is non-affirmed, it usually points back to a few core areas: the plan of care, documentation narrative, the timing and sequencing of the interventions, and that can feel uncomfortable because that shifts the conversation from that external friction to more of that internal accountability. And under WISER, documentation stops being just a compliance issue and becomes operational data. Things like first pass affirmation rates, resubmissions, and then the stalls in the care plan are so much more visible. And that naturally raises concern for providers, especially in environments where productivity, compensation, financial risk are closely tied to performance. WISER is uncomfortable because it increases visibility, but when visibility is used as feedback rather than judgment, it can actually strengthen clinical practice.
Well, thank you so much. Um, I've definitely heard similar things throughout the country. And how about for the groups that you're working with? What do the early wiser results look like? And what is driving those outcomes?
Yeah, that's a wonderful thing for us to look at to reflect on what has been working, maybe what's not been working. And for the groups I'm working with, is it's been a little bit mixed, but the pattern is pretty consistent. Groups that already came in with strong clinical guidelines, clear documentation standards, and defined pathways for escalation, they're generally performing pretty well. Their early results show fewer documentation driven denials, clearer alignment between clinical decision making and reimbursement rules, and really more confidence at that provider level. We're not seeing as much of that anxiety as I talked about in the first question. But on the other hand, those practices without those foundations are seeing WISER expose existing gaps. These gaps show up as increased provider hesitation, delayed escalation to advanced therapies, inconsistent documentation, and anxiety, like we talked about in question one. Early on with the groups I was working with, we did have some delays. There were some times where it took almost a week or longer to get a response. And we had a case where the data service came back as only 1 day. There was only units approved for one application, but it appears that those have worked themselves out and things are running a lot more smoother now.
Oh, well, that is great. Now, the future effective LCDs that were withdrawn, the MACs identified products that could be covered based on their published evidence. The listeners have been wondering if you received any positive prior authorizations for any CTPs that were not on the list of covered products. And are you able to tell?
Yeah, so fortunately for the groups that I've been working with, I've been advising them to stick to those products that were on the covered or discretionary list. That proposed list, although it's no longer active, it really provides a useful clinical reference point for which products had the deepest evidence at that time. And that still matters when we're building pathways today. To make good medical decision making means choosing products that not only fit in the patient's needs, but are supported by that robust clinical evidence that demonstrates efficacy.
You mentioned that sometimes things weren't working so well, and sometimes things were. Now, when the WISER is working well, what does that actually look like inside your wound and ulcer management program?
Yeah, so I think when it's working well, You've got care plans that are very intentional. We're not reactive. They're not just documenting what they did that day. They can clearly explain why this intervention, why now, and what's going to come next. There's a sense of direction to the care plan instead of just visit to visit decision making. And that documentation tells that longitudinal story. The notes connect the dots over time: assessments, goals, intervention, patient response. It lines up across the weeks. So somebody outside of the organization or outside of the practice can actually review that chart and understand that progression of care without having to read your mind or infer intent. And the escalation feels deliberate. It's not defensive. We're introducing therapies, we're introducing the CTPs when there's a clear rationale. Teams aren't just escalating because they're worried about timing or revenue. They're escalating because that clinical picture supports it, and they have the reasoning to back it up, and that's visible. And providers are feeling supported. And this one, again, going back to question number one with that anxiety, this is a huge part of it. In programs where WISER is working well, these providers don't feel like every non-affirmed decision is a personal failure. There's psychological safety around reviewing outcomes, tightening that documentation, and adjusting plans, but without any blame attached to it. And the strong programs are treating WISER as an early feedback tool. It's not a final verdict. We're looking at patterns. We're reviewing at the program level. We're not singling anybody out, but we're going to identify where planning, documentation, education, and operational changes maybe need to improve to better support WISER. And that over time, WISER actually reduces that friction. Ironically, once teams fully understand WISER, things get easier. There's less rework, there's fewer last minute scrambles, and there's more confidence in their care decisions. It becomes a part of how the program thinks, not just something it reacts to. And, good under WISER doesn't mean perfect documentation. It means that we have clear thinking that's clearly communicated.
I think that's been one of the problems that wound care has had in auditing, period, is that we really haven't told the clear picture of what's going on with the patient and maybe not even described our standard of care very well. So I think this will be very good because if it's gelling that up and having us tell our story in a better way, then I think it'll be great. And plus, we know the WISER program is a 6-year program. I would guess it's not going to take them everybody 6 years to figure out that they need to tighten their story up and paint their picture very well.
Agreed. And I truly believe that WISER, yes, this is focused on the CTPs, but once you understand how to document and show clinical necessity and medical decision making and where you're going with your care planning, that rolls into all the other advanced modalities that we use. And so patients will have access to those quicker because providers will feel confident in that.
Fabulous. Now, I wonder if the WISER program has caused any changes to your scheduling of patients for the application of CTPs.
Yeah, I do think that there's been a change to the scheduling in that we're seeing a shift towards more intentional timing. Practices are being more deliberate about ensuring patients truly meet criteria before they're even scheduling an application. Completing that standard of care, the clear documentation and progression. It hasn't reduced access to CTPs, but it's definitely reduced that reflexive or premature scheduling. So for many of my groups, it means it's a little bit longer lead time before that first application. Not that we would apply a lot of times on that first visit, but we have to we have to wait. We have to submit to WISER for that approval. You can't just hurry and slap a graft on anybody. There's more coordination between assessments and visits, and then those application visits. There's kind of more going on in between. And then there's a tighter alignment between the documentation, authorization, and scheduling. So ultimately, WISER is pushing scheduling to be clinically driven rather than calendar driven, which, when done well, that really actually improves efficiency and reduces that downstream friction.
Fabulous. Now, when the prior authorizations were denied, what were the major reasons?
Yeah, so most denials haven't actually been about the product or the therapy or the graft itself. What we're seeing is that it's far more driven by, again, those documentation gaps, timing issues, or a lack of clarity around whether the wound truly meets criteria. for escalation at that point. In many cases, the clinical decision is reasonable, but the record doesn't clearly support or demonstrate that that standard of care or lack of progression or readiness for that CTP, it's not been articulated in that note fully. And so when those elements are clearly documented and aligned, a large percentage of those denials are either avoided altogether on the front end, or they're overturned on resubmission. So if you submit one and their A1C is out of date, or they're not compliant with compression, or the provider just forgot to document something, or they forgot to submit the vascular exam with their note, you can easily resubmit that and get it fixed. And then it's a learning opportunity to remember to do those going forward, because you got that feedback on what was missing.
Fabulous. So, Katie, before we close this episode, do you have any recommendations for our listeners about CTP coverage and the WISER Prior Authorization Program?
Yeah, my main recommendation would be to make sure that your chart clearly shows why you're escalating care and why now. Again, most WISER issues are not about the product. It's about whether the clinical reasoning is easy to follow over time. If a reviewer, be it AI or human, can clearly see that the standard of care was established, how the wound responded, and why escalation makes sense now, coverage decisions are much smoother. And so I developed a WISER provider self-assessment that will be available to all the listeners today to kind of to help with this. It walks providers through a few simple but really crucial questions. Does my documentation tell a consistent story? Is my plan of care clearly tied to my assessment? Am I documenting escalation intentionally, not just because the calendar says it's time? So it's not a checklist for WISER. We have those. There's the big document you can look at. You can refer to your LCD, but this is more of a quick way for providers to pressure test their own documentation and decision-making before a prior auth is ever submitted.
Well, thank you very much, Katie, and thank you for preparing it. Listeners, don't forget to download it, because I think this self-assessment tool is really good. It really helps you think about yourself and how you are presenting your information and your work in the medical records. So, Katie, thank you for answering our listeners' questions. We appreciate that you were willing to share your real life experience about this new prior authorization program. It sounds like you and your professionals have mastered the process that you will need to follow for the next 6 years. And to all the listeners out there, I'm inviting you, if you happen to be submitting and have really good things to share with us from the other WISER states, please let me know, because over the next few months, I will interview different stakeholders in the different states. So thank you also to the loyal listeners. Without you, reimbursement readiness would have no meaning. Please keep sending me any topics that you would like the teams to cover and or questions that you would like us to answer. And please join us for episode number 21, when Yesenia Banks will be addressing consolidated billing, which is a topic that has been requested by many listeners. Until then, keep doing the right thing for your patients and for your business. Talk to you soon.